Good evening to Dr. Nelson. We're from Group 7. Today our topic for our presentation is crisis communication during pandemics. Before we start our presentation, let me introduce ourselves first. My name is Azara Juraimi.
My name is Muhammad Fahmi Solihin.
My name is Dayang Nur Yasmin Kase.
My name is Muhammad Nuruddin.
My name is Siti Nur Artika.
My name is Nur Sahira.
First and foremost, for the introduction, crisis communication during pandemics is essential for effective information sharing during global health crisis. Such as for the COVID-19 pandemic, it showed the critical role of communication in shaping public behavior, maintaining trust, and managing fear and misinformation. Communication also functions as a tool to deliver accurate health updates, to promote transparency, and build unity within communities. It is also highly relevant in communication studies because it highlights the role of media, government agencies, and digital platforms. It also influences public perception and compliance with safety measures. However, miscommunication or delays can increase panic and reduce effectiveness of public health responses. Therefore, understanding crisis communication strategies helps explain how societies respond to collective threats.
Next is media dependency theory. For media dependency theory, it explains that people form a dependency relationship with the media. Dependency is more than just using media. It means people rely on media to fulfill certain needs. These needs include information, guidance, entertainment, and decision-making support. In modern, information-driven societies, people become highly dependent on media system. Media influence how individuals understand political reality, social issue, and daily events. And also, people depend on media for leisure, relaxation, and emotional satisfaction.
Media dependency theory and COVID-19 pandemic. The COVID-19 pandemic created extreme global uncertainty, risks, and social disruption. This situation increased society's dependence on media for accurate and essential information. Using media dependency theory, the report examined how dependence function at two levels. Micro level, which is individuals relying on media to cope with fear, confusion, and risks. Another one is macro level, which is societies depending on media for coordinations, updates, and crisis management. MDT state that dependence on media rises during periods of high social instability when people need reliable information to meet critical needs. During the pandemic, this theory was clearly demonstrated as citizens turned to media to make sense of rapidly changing events and to manage uncertainty.
So, media dependency theory during COVID-19 on a scale of number 1 is micro level, which is individual reliance on media, and number 2 is macro level, is societal reliance on media. So, on micro level, which is individual reliance on media, during the COVID-19 pandemic outbreak, individuals depend on the media because it's the only reliable source of information. Furthermore, the government imposed a strict movement restriction during the pandemic. Hence, this has led to increased dependency on media in order for them to, number 1, to understanding the threats. Individuals needed accurate information regarding the COVID-19, its transmission, symptoms, and severity. Updates on case counts, health cautions, and scientific advancement were given through social media. Number 2, adjusting and implementing precautionary behavior. Individuals required to adjust to a new norms and implementing a new precautionary behavior by adhering to public health directives. Number 3, guidance behavior. Media play a crucial role for learning and adopting precautionary behavior and complying with public health directives. Example of information on washing hand and wearing masks, social distancing, and lockdowns rules. Okay, next is macro level, which is societal reliance on media. At the societal levels, the media system was essentially for the smooth, if disrupted, functioning of society can lead to, number 1, crisis management and coordination. Governments and public health authorities depended on the media to quickly and broadly disseminate official communications, guidelines, and emergency alerts to the entire population. This coordinated effort was necessary for a collective response, as examples such as mass testing, vaccine rollout, and such other things. Number 2, setting norms and mobilization. The media helped frame the crisis and mobilize the public for collective action. By highlighting the severity of the pandemic and the need for public compliance, media message influenced the social norms around health and safety, such as making mask wearing socially acceptable for the society. Number 3, information exchange among experts. Beyond the public, media platforms, particularly digital channels, serve as an avenue for scientists and medical researchers to share crucial data and collaborate in real time, accelerating the scientific response to the evolving virus.
So next is about changes in social behavior toward individuals during pandemic. During pandemic, it's not only individuals It's also within in a group or organization and companies. It gave impact on our education, economy, politics, and social and religion. It's all because of government action. For example, from going to school need to study at home. Okay, next, healthcare system dependence social media. There's a lot of problem that happen on healthcare system, so there depends encourage public to follow the SOP and it also to public healthy measure promote online. That's
Message framing that were used by a healthcare system during crisis based on media dependency theory. So first of all, what is message framing? Message framing is simply how we present information, not just what we say but the angle or emphasis. So first of all, second of all, health authority use three main framing strategies, which is risk and agency framing, gain and loss framing, and narrative or testimonial framing. So for narrative framing, they use real stories from healthcare workers to build emotional trust. When people hear from doctors, nurses, or community members about their real experience, it creates an emotional connection and trust. This narrative helps people to understand the crisis is real and encourage them to follow health guidelines. For risk and agency, risk framing works by showing the severity of the situation. For example, rising cases and overwhelmed hospitals can moderate fears to motivate people to take precautions. But too much alarm can backfire, causing panic or information fatigue where people stop listening altogether. And lastly, gain and lose framing. Gain frame focus on benefit. For example, vaccination protect your family. Meanwhile, lose framing focus on consequences. For example, not following guideline puts vulnerable people at risk. Different people respond to different frames, so using both risks more people. Okay, so this will impact because it shapes emotional, cultural, and cognitive response.
next is impact of social media on changes in individual social behavior during pandemic. As we all know that social media during pandemic is increased. So there is two impact, which is positive and negative. For positive impact, it can transform people's life by using media platform for business, for example, Cairo Aming. And negative impact, media social becomes source of cyberbully, where people use media social to share their appearance and they will receive a criticism. So it will lead to suicide.
So in conclusion, the COVID-19 pandemic demonstrated how deeply individuals and society depends on the media during times of crisis. Media became essential for understanding the virus, guiding behavior, and providing emotional supports, while also enabling governments and experts to coordinate responses and shape public norms. However, the pandemic also exposed the risk of misinformation and emotional strain caused by media overuse. Overall, the crisis highlighted that the media dependency is a double-edged sword because it can inform and unite, but it can also mislead and overwhelm. That need to understanding this balance is crucial for managing future emergency effectively. So that's all from us. I think thank you.